Moray Curran here. I'm going to start with this webinar and try and keep it to the 30 minutes. So thank you for joining me. Today's webinar is titled, Why Do You Want to and Why Should You Offer Services to People Diagnosed with Cancer? So this is who I am. I've been in the industry for 27 years. I pioneered oncology aesthetics training in our industry. We teach in 14 different countries, about 7 languages, and adhere to global standards. What supports us is clinical studies that enhance or are based off our policies and procedures. So we are thrilled about that. I just want to clarify, I've been getting emails from some of the estheticians asking if they will receive a certificate at the end of this webinar series. This is not a certification course. Our trainings are typically 24 hours, which is 3 days for in-class trainings. Otherwise, the online training is 30 hours long. So one only gets a certificate if you actually do the training, and you do have options of in-class or online. If you're interested in that, you can go to our website, which is oncologytraining.com. Go to the training tab and click on events or online, and you'll be able to find out what options are available then. In our industry, it's time to change our thinking quite dramatically, even though a couple of us in the industry have already been thinking of this years ahead of time. I used to work in a skincare lab where we had a lot of people contacting us about products and ingredients that could be used on people going through cancer treatment. And so this is what sort of prompted me to go ahead and do the research, because I was always taught not to touch people with cancer. So today there are many, many more cancer patients out there, or cancer survivors, that are very grateful for the fact that we are now embracing and allowing them to come to the salon or the spa for treatments. Also, when we first started to teach, we had a number of estheticians telling us that they did not work with sick people. And I was just horrified for the most part, because I think there are more people in the world with either a mental illness or a physical illness than we know. And if you really do ask the questions, you can find out that somebody is on antidepressants or a medication of some sort for a physical or emotional issue. So I think that as an industry, we need to embrace people with all health challenges, irrespective of what they are. I think this is going to be kick-started with the coronavirus as well. It's definitely not the first example, but it is a global pandemic, and we can seriously see how this is affecting our industry. So once we get through this time, hoping that there will be more and more people, once they sort of get their businesses up to a stable perspective, to start thinking about how to implement and encourage people with health challenges to come to their salons and spas. 2 other fellow colleagues of mine who also are very forward thinkers is Chris Campbell from Hale & Hush, because she has been working with me right from the beginning and has always had product available for people that have got cancer and lupus, and people that have got diabetes or they're gluten intolerant. So she has a product line that has always been very effective for people with health challenges on their skins, irrespective of what the cause is. Erin Madigan-Fleck is also an educator. She also teaches our programs. She has her own programs too, but also very much supportive of other health challenges, and has a lovely program out there called Immunoaesthetics. Let's cover some of the myths in our industry. When I was still at school, I was told not to touch people with cancer because cancer can spread as a result of massage therapy, which we know today that there's over 250 clinical studies, probably even more, that clearly say that massage therapy does not spread cancer. Massage therapy is provided to people in medical settings or healthcare settings for a number of different reasons, from insomnia to nausea, vomiting, pain, and there's some other side effects that I don't remember at this moment. So massage is definitely embraced based on its clinical studies. And you can massage most people with cancer. When I say most, it means that you need to know what side effects they have in order to determine whether you can touch them or not. One example would be hand-foot syndrome, where heat and friction are contraindicated to that condition. Therefore, you cannot massage the hands and the feet. Other times, a person might have a low platelet count, and they might be very prone to bruising and bleeding. So again, even a light touch will cause more bruising and bleeding. So therefore, it would be contraindicated. So really important for us to know what the side effects are to either the disease and the treatment, and then how to modify around it to ensure that the client does get a service or a treatment from you. I just want to also elaborate a little bit on that solid tumors, if a client has solid tumors, you obviously work around them. But a question that's often asked is with the liquid tumors, which is like your blood cancers, which is leukemia and multiple myeloma, or your lymph cancer called lymphoma, because cancer cells are already in the lymph and the blood, they are circulating throughout the body. So even doing massage is not going to spread them. They are moving around. However, you still need to modify the massage, okay? The other thing, cancer is contagious. There are still cultures in the world, you know, we are first world countries. There are also still developing countries out there. And in some of these developing countries, they believe that cancer is still contagious. So if you were to suddenly open your doors to people with cancer and they were to see this, they may likely stop popping in to have treatments with you because of the fear that they would get cancer. There's also other cultural beliefs. The word, the big C letter, sometimes the older generation do not want to discuss the C word. So it's just one of those conversations that doesn't get held in amongst family members and friends and that. Fortunately, the world today is talking about cancer a lot. So it's not the stigma that's attached to it as it used to be. Look, it's still a stigma in some countries, but here in North America particularly, it's not such a big stigma because of the awareness that's going on with all the fundraisers and all the events that are happening to help prevent cancer. So I do find that sometimes certain cultures don't want to discuss it, but when it comes to these cultures and they're clients of ours and they want to have services with us, they need to be imparting pertinent information to us so that we can provide a safe treatment by modifying the treatment. So we have to learn to talk to them and get necessary information out of them. And if it's just very short, direct questions without them going into detail, then that's what you have to do. There might be the odd occasion that you may have to say, you know what, I'm not comfortable doing this treatment for you because I don't have sufficient information and I'm just so concerned that I will cause you more harm. So you mustn't be afraid to say that as well. Also, something that goes on with some cultures is a person may have symptoms, they may not have symptoms, but for some reason they've, you know, maybe had a blood test and they've come to find that the doctor has called in the family to tell them that this person has been diagnosed with cancer. And so the person themselves is not told that, but the family is. And then the family, when the time's right, will actually tell the person. So we've just got to be mindful of this. We're not oncologists. It's not our role to tell somebody what treatments they need. And there's a way to deal with it from a psychological impact. But just be mindful of people's cultural beliefs as well, especially if you want to have them keep coming into your facility for services. Now, let's look at the global cancer statistics. By 2040, the global burden is expected to grow to 27.5 million new cancer cases. They state here, simply due to growth and aging of the population. It is not just the growth and the aging of the population. I'm seeing more and more melanomas that are prevalent in young ladies in their 20s. I'm seeing more and more teenagers diagnosed with leukemia, the blood cancers. Is it because of the environmental issues around them? What is the cause of these things? Nobody knows what's the true cause of each individual's cancer. I mean, there's a whole bunch of, different causes, but let's just not go into that on this particular webinar. Now, many cancers have a very high chance of cure if detected early and treated properly. What can help with this is awareness. We can make a difference. We can start to promote services. We can promote modified services. We can talk to clients about cancer, and we can do little educational events and stuff that bring the awareness out there. When it comes to skin, we're seeing bodies in a naked state or half naked state. We're seeing parts of the bodies other people don't see, not even the client themselves. If we see something unusual on the skin, it is our job to make the client aware of it. Take a picture of it, next time they come in, take a picture of it, make a comparison, say, oh my gosh, we're seeing some changes here. The minute sometimes a person sees two different images in front of them with changes, that makes them a little bit more aware, and then they will probably step out and go and visit with their physician if they haven't done so. So there are plenty of things that we can do to assist with that just by using our eyes, training them to recognize changes, using our hands, that's the touch that we, without using our fingers and stuff, even though a lot of us do wear gloves and stuff, but it's really important to also realize that sometimes other cancer tumors can manifest in other parts of the body, but can also push through the skin. An example of a different type of cancer that kind of manifests through the skin would be lymphoma. Whilst it is a cancer of the lymphatic system, what happens is the cancer cells will, they would conglomerate or gather together in the lymph system, but then they get plugged up in the lymph nodes because your lymph nodes are filters and purifiers. And then as the lymph nodes are getting more and more full with the cancer cells, they are getting bigger and bigger, and they become quite hard, and they can, I've seen them as big as the size of a golf ball. So if a person's got these swollen lymph nodes all around the body and they're all full of cancer cells, it's something that we can address with them and say, you know what, you really need to go and see your physician about that. It's not comfortable to massage on them either. So, but these are telltale signs. Not all cancers have symptoms, but those that have symptoms, and if people think that, oh, well, that's just normal, and there's strange things happening on the body, it's not normal. So on the statistics too, let's also just look at who our market is, because if you've got predominantly women, which our industry is predominantly women, but there's more and more men coming into our industry as well. So 1 in 2 men and 1 in 3 women will get cancer in their lifetime. And just throwing something to that, approximately 60+% of people with diabetes will get cancer in their lifetime. So this also makes us think about, do we need to know about diabetes as well as cancer? And the answer is yes. We need to know what the common diseases are out there and the manifestations of skin-related issues that will affect the services that we provide. You yourself will know someone who has cancer or has had cancer. So somebody can be active, and that means that they're going through treatment right now, or they can have a history with cancer. Or you will know that somebody that also knows somebody that has a history of cancer or is going through cancer treatment. And so when you start to open your, open the conversation and start talking to people about it, just like you can start the conversation very simply. Do you know anybody with cancer right now? Oh, yes, I know X, Y, and Z. Can you tell me a little bit more about them? Are they living here locally? Do you know if they would be interested in coming to have a modified service with me? If you do if you've been trained in oncology aesthetics, or you do plan to get trained in oncology aesthetics, talk to people about your specialty. In the US, you're a licensed esthetician, but you can specialize in oncology aesthetics. Oncology aesthetics is training. It's not a term that you would use with your clients or cancer survivors. Cancer survivors know what oncology is. The average person on the street knows the word cancer. They will resonate to the word cancer. So you want to, if you're going to do any kind of promotional work to get cancer survivors in there, you need to relate to it in that way. And then, sometimes people also have a little bit stuck on the word aesthetics as well. Some people are not quite sure how to relate to it. It is very much a North American terminology and in some European countries, but You know, beauty therapy is the other term that's actually used there. But talk to people. It is not difficult to explain that you've been trained in the disease, in the treatment, the side effects from the treatment, and how to modify what you already know and to apply it. Now, why do you want to do this too? Is it that you really care about your local community and you want to give back to the local community? Some people do, and they do volunteer work. And I encourage volunteer work, even if the volunteering is just once a month and it's only for 2 or 3 hours. If you show that you're reliable, if you show that you're dependable and the people like you and you can build a relationship with people in that industry, they will start to refer to you. They'll either bring you into their community to do things in their facility, or they will refer out to you. Another example of doing some volunteer work would be to bring in a local cancer center or hospital, find 2 nurses that you can provide a facial to, bring them in with the intent of educating them about your knowledge about the disease and how you would modify treatments for cancer survivors. That way, the nurses get educated about what you can offer. So it's a really good networking opportunity. If you're now wanting to know, you know, how can I get cancer survivors into my spa? And if you're just going a direct approach with a new business, you also have to ask yourself the question, how am I getting anybody into my spa? Anyone that becomes a potential client, irrespective of whether they have cancer or not. So spa menu, we're talking about tomorrow, or actually Wednesday. So we'll be talking about setting up a separate or the same spa menu and how to word things in that. But you've always got to focus on bringing people in, you know, so-called healthy people, but also people with health challenges. If you have an existing business, start to educate your existing clients about that. Tell them that you've been trained and that you really want to have a more meaningful approach to aesthetics, and you want to work with people, you know, that have these health challenges and that, and do they know of anybody that can come in? And, you know, if it's one of your existing clients that you've had a relationship with for like the last 10 years, explain to her that it's perfectly okay for her to come in if she's feeling well enough for her to have spa treatments or salon spa treatments in the time that she's going through treatment, because you know how to modify these things for her. It gives a sense of comfort to the client if they know that you've actually had some training in it. So you've got to educate them if you're going to promote the services to them. On the other hand, you can also educate them about why you would postpone a service or treatment, or why you would offer an alternative. Because we all know that if blood counts are not normal during chemotherapy, the client themselves is at high risk for infection. So if you know the client is, you know, sort of 3/4 of the way through their chemo treatment and they're, you know, experiencing a number of side effects and they're not feeling so great, for you to do a regular service on them would probably make them feel quite bad for the next few days. So rather postpone it until they start to recover, or offer them something that's an alternative, or shorten the treatment as well. So important to remember that. The third point that we have here is either converting your business, which is a regular salon spa, into a streamlined cancer concept salon spa. Do you want to really place more of a focus and work with these integrative oncology facilities and that to actually specialize in, you know, with people with cancer, whether that's bringing in integrative oncologist, a chiropractor, a nutritionist, you know, a yogi master, all these other modalities that can support what you're actually doing. So either you want to convert or create a new business. If that's what you want to do and it's very specialized for people with health challenges, just email us on that and we can help you from there. I'd like to also define from the National Cancer NCI, National Cancer Institute, their definition of a cancer survivor is one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. But the last paragraph is very pertinent here. In cancer, a person is considered to be a survivor from the time of diagnosis till the end of life. So please remember that. In the medical world, a person is a cancer patient In our world, they're clients, but it might be appropriate to refer to them as cancer survivors. Just note that some people hate the word survivors, some people hate the word patient. So might warrant a conversation to find out what they are comfortable with. Another thing that's really important too is to remember that traditional cancer treatment, that would be surgery, chemotherapy, and all the other drug therapy groups, plus radiation therapy, are typically invasive treatments. They're hard on the body. Whereas when you're trying to encourage people through active chemo and in recovery to come through to the salon and the spa, you want to be stepping back on invasive spa and salon treatments. In other words, you don't want to be doing dermal needling or an aggressive microdermabrasion or a pretty aggressive chemical peel. We want to focus on the person's recovery and making sure that their skin is being soothed, protected, and hydrated during treatment, but also that we can cope and help them through it from an emotional perspective. So think hospital invasive, think salon spa, non-invasive. And that's particularly during active treatment. Once the person is in remission, you can inch forward slowly and start to integrate the more aggressive treatments that we offer in the salon and the spa. Now, why would somebody with cancer, aka cancer survivor, come to you to have a service or a treatment? There's going to be an intention, and you need to know what that intention is. Why are they coming to you for treatment? Is it somebody just bought them a treatment? Why did that person buy them a treatment? Was it to help them relax, or because they got symptoms that they're trying to find relief from, or is it because their appearance has been affected and they need help with that as well? The next 3 slides will just cover a couple of the different intentions of treatment. And in a lot of the medical settings, there are mind-body therapies, where these are recognized therapies that are offered to people going through cancer treatment. And whilst things like yoga sometimes are an offset for some salon spas, sound therapy can be done, Ayurveda, some facilities will have acupuncture, aromatherapy, amazing. Aromatherapy is not just like, oh, well, you know what, you can grab a bunch of essential oils and you can just mix them up and use them. It is way more complicated than that. And aromatherapy is being used in at least 140 hospitals in the UK. It's used from a psychological standpoint and from a physical, in other words, with wound healing. So you need to get adequate training to use aromatherapy properly if you're wanting to use that with people, especially undergoing active treatment and in the medical setting as well. So obviously, if you do any of these treatments in your facility, let the local cancer centers, women's centers, hospitals know, because if they don't have this available, they can always refer out to you. People are always looking for symptom relief, especially from radiation and or mostly chemo and the other drug therapies, because the drug therapies are systemic. So massage therapy, there's over 250 studies on massage showing the benefits for pain, nausea, vomiting, insomnia, and I don't remember some of the others here. So massage therapy is definitely can be done. There's also a massage therapy protocol for peripheral neuropathy, which requires a lot of homework with the client as well to ensure that it is effective. Reflexology, acupuncture, and acupressure are balancing treatments, also helping with symptom relief. And then these treatments that are up on the right-hand side there, like manual lymphatic drainage, can be used with people with cancer post-surgery. If the client starts to develop lymphedema or at risk for lymphedema, it is not within the scope of our license to do manual lymphatic drainage. So be very careful with that, because it can be contraindicated to somebody with cancer. Skin taping, this is a lifting of the skin to allow the lymph and the microcirculation to flow, but the adhesives can tear up the skin if they're incorrectly removed, or there could be an allergic reaction to some of the adhesive in the tape. Cupping for somebody who's got a low platelet count, there can be some serious internal sort of or superficial bruising and bleeding, and so we've got to be really careful with that. And of course, pressure therapy is used in a medical setting to improve the circulation. So any service you offer that encompasses symptom relief, yeah, it's absolutely fabulous what we can do. A big part of what we do is obviously handling people and their appearance. We all have a sense of vanity to some, to some point, but people don't want hair and excessive hair that can be caused by drugs and stuff like that. So hair removal services. A lot of us don't offer color styling, and we really should look into it because it really is about the person that doesn't know much about color. And color can be very powerful for a person from a healing perspective and from an appearance. So helping the person look at themselves with certain colors against them and to wear clothing, scarves, makeup that actually suits their skin, hair, eyes and stuff actually will make them look a lot healthier versus looking a little bit more ill. For cosmetologists or hairdressers, obviously, hair shaving services, and also wigs, whether it's actually wig styling or wig fitting and wiglet fitting, which is just for partial alopecia. You can get some therapists would also, be trained as a fitter, and so they can fit breast forms and, mastectomy wear and swimwear and stuff like that. Everything that the woman who's had a breast or both breasts removed to help them look feminine and appreciate their bodies. These services on the right are very common as well because a lot of people can lose hair on their head, brows and lashes, and they need help with brows and lashes, particularly if they see a ghost of themselves and they need some fraying with the brows. So make sure that that can be offered to them and see if you can teach them how to do it. Nails, even just painting their nails makes a person, especially a woman, sort of feel better about herself, okay, because she's looking better. So we might think this is all silly vanity stuff, but truly when you're in the role of somebody who's got all these imperfections that you've never had, it affects you psychologically. Same thing with the skin imperfections. Somebody who's going through cancer could have either radiation and chemo affect the melanocytes, which is, some of them are detrimental to the melanocytes, which means it either causes them to become inflamed and cause hyperpigmentation, or it can cause vitiligo. And so all of a sudden now this discoloration, starts to affect how the person feels about themselves. So we need to know how to help people get around skin imperfections and different rashes and stuff without exacerbating the situation. Micropigmentation, like the areola tattooing, or perhaps, touching up with vitiligo and that, this needs to be done post-treatment when the person's in recovery, but still it's helping them with their appearance. Henna, it's a temporary thing. Again, it's just for somebody's psyche to draw the attention off an area that is either affected, like from alopecia or scars and stuff like that from a amputation. So if we can help a person feel good about themselves and look good, we're actually benefiting. Now, let's not make general assumptions here about people. If they tell you that they have cancer or they've had a history of cancer, because there's a huge difference in how you would actually provide services to a person with an aggressive cancer and a non-aggressive cancer. Let's give you an example of an aggressive cancer as an inflammatory breast cancer. Typically, that's a skin thickening, so chemotherapy is administered first, very high dose and very severe side effects, whereas a non-aggressive cancer would be with somebody who has a slow-growing lung cancer tumor, and they only need to have chemo every 3 months, so therefore they've got minimal side effects. So if you've got these two people sitting in front of you, your non-aggressive cancer client or survivor is somebody that you can maybe do dermal needling on. It might be somebody you can do microdermabrasion on, do a pretty aggressive chemical peel, recommend retinol with, obviously sun protection and stuff. So you might be able to do that with that non-aggressive cancer survivor versus the one who's got the inflammatory breast cancer, who's got severe side effects. You're going to have to really cut down the length of your treatment. You're going to have to cut out a lot of the steps in your treatment as well, and just to ensure their safety. So never make the assumption to treat all people alike just because they have cancer, or all people alike just because they have the same type of cancer and the same protocol. Every person is different, and you treat them as an individual for every treatment they come in for. In this particular webinar, we're going to focus on lashes because, so every webinar will just focus on a different treatment. Just to go into a little bit more detail with that, lashes, if a woman particularly doesn't have lashes, she feels like she looks at a ghost of herself. So what is it that we can do to help her with that? Chemotherapy causes hair loss, and whether it's hair thinning, the hair shortened, there's a complete loss because it might be a recurring cycles of loss and regrowth. So one can look at lash strips, magnetic lash strips as well, lash extensions, or even growth factors. Just be aware that lash strips, there might be glues and magnets there, and however the lash liner is adhered to the skin, is the skin going to react to it, especially if that person's on a very aggressive cancer. So we want to be aware of lash extensions as well with the glue. Can everybody have them? They've only got sparse lashes. Well, do you need to use like a fan lash, to cover that loss there? If you're using a growth factor type product, make sure that the client understands why it needs to be applied to the top lid only and not to be anywhere else on her face. Otherwise, she might develop hair growth in that area. If none of these options are an option, then work with the watercolor method. The watercolor method is using a flat pressed powder, either a brow powder or an eyeshadow, with an artist brush that has very long hair on the one side and angled down to very short on the other. And it's a matter of just wetting the hair on the brush, dabbing out any excess of, tap it into the powder, and then doing one quick sweep along the lash line. And so you've got to have a very sort of firm hand for it. And it's not stark and bright, so it's not going to like stand out. It's just going to give a subtle appearance of there being a lash line there. On the flip side now, the targeted therapy drugs actually can cause excessive hair growth, just like the image that you see here. And with this particular client, you need a lash comb the lashes out and trim them with scissors that have like a little sort of circle on the end there. And the last thing that I'm going to finish off with here is, if a person has experienced loss of hair on their head, they haven't lost hair on their scalp, on their brows and their lashes. Sometimes the brows and the lashes actually eventually fall out once they have completed chemotherapy. So they may come to you after they finished chemo and said, well, I'd like to have extensions now, or I'd like to have some tinting done, or whatever else. And all of a sudden their eyelashes fall out. And then they come back and say, you know what, my eyelashes fell out after you did the treatment. It is nothing that you did wrong. It is something that is going to happen as a sequence of events as a result of chemo. It's just that person didn't lose the brows and the lashes during treatment. She's now lost it post-treatment. So not your fault, but always remember that. Just another added note here, microblading and micropigmentation can be done post-chemotherapy. If somebody's had localized treatments of surgery and radiation to the breast or the abdominal area or the leg, they can have microblading and micropigmentation, again, depending on their medical history with medications and stuff like that. And the pigment may not take in the skin for about 4 months after chemo. So anyway, I hope that this has been informative to you. I'm coming to the end. I have run over a few minutes here, but I'm hoping that you can join us for the other webinars that we have for the remainder of the week. So enjoy the rest of your afternoon, and thank you very much for joining us.